So I am Nancy White, and I'm from Houston, Texas, and we have the Unique Mind Care Center there, and I thank you for coming. I will say that up until Thursday, I thought this was a 40-minute talk, and it's only a 30-minute talk, so I'm going to speak fast and maybe skip over some things, and if you have any questions later, be happy for you to come out in the hallway and ask us. The purpose of my presentation is to really bring more awareness about addiction and what we can do about it and what an anti-aging effect addiction has. And I'm concerned. I noticed that last year there was standing room only when we talked about depression, and today we're talking about addiction, and there's very few people here. I'm wondering if that isn't significant, because that's what I notice in the world, is addiction is beginning, and from my perspective and my therapy, beginning to sort of overtake us, and everywhere I turn we have another addiction problem. We've always had addiction problems. We've had addiction problems for probably forever, but 50 years ago basically it was alcohol. And alcohol has never been pretty, but it didn't cause a lot of the problems that we're seeing today with the exotic drugs. And what we're really concerned about is we are beginning to get many calls from people who say, I am addicted to a prescription drug. I broke my ankle skiing. I took some oxycodone, and here I am. I can't get off of it, etc. So I really want to do what I can do to raise the awareness of what's going on out there, and especially with the doctors, so they can ask the right questions and perhaps do some of the things that they might do to help eliminate, to diminish the problems we're having. So there's definitely a rising use and abuse out there on drugs and alcohol, and it has a big effect on aging. There's been a dramatic increase in the opioid and the stimulant retail prescriptions over the last 20 years. NIDA said that in their study it was 5.2% annual increase in the opioid prescriptions, mainly hydrocodone and oxycodone. And then there was a 12.8% annual rise in stimulant prescriptions, mainly methylphenidate and amphetamines. And this is concerning. It suggests that people born after World War II tend to drink more than earlier, when alcohol was less tolerated. Drinking patterns, we find, have rather remained stable with age, and a significant number of people I observe, and the literature says, alcohol consumption later in life, they're more sensitive to it, and it seems to also be more sensitive than when they were younger. It's taking its toll on people. We just had a man, 62 years old, come in our office who was a very prominent, very well-known businessman in town, and he had been drinking since he was a teenager, and finally it had gotten to him. So he is just one story among millions. So we've got an estimated 52 million people that have used prescription drugs for non-medical purposes at least once. And those that reported in this past year non-medical use, 14% met the criteria of abuse and dependence. Surveys conducted in healthcare settings have found increasing prevalence of alcoholism among the older population. And rates of alcohol-related acute care admissions for older people are similar to admission rates for heart attacks. That's really surprised me. It's clear that NIDA reported, the National Institute of Drug Abuse reported, it is clear that addiction is a disease of the brain. And the body responds to stress through the hypothalamic pituitary adrenal axis, creating secretion of stress hormones. The glucocorticoids result. And this chronic excessive glucocorticoid secretion can have adverse health effects. Alcohol intoxication activates that HPA axis and results in elevated glucocorticoids. These elevated levels may contribute to the alcohol's pleasurable effects, Chronic alcohol consumption and chronic glucocorticoid exposure can result in premature and exaggerated aging. And this came out of NIDA, and I think this is very important information. And I really hope that many of the doctors will begin to look more closely at what is going on with their patients. It is not always obvious, especially if they're on alcohol, because they're not going to be, usually not going to be drunk when they come in your office, so you don't anticipate what the problem is. Addiction affects the brain. It's a disease characterized by dysfunction of chemical signals that go to and from the forebrain and sets up a craving withdrawal cycle. It's related to an imbalance of glutamate in the nucleus accumbens, which is the brain's reward center. It triggers use without regard to consequences.